My name's Dave Inglethaler. I'm the director of TGen North, which is our infectious disease wing at the Translational Genomics Research Institute. A couple things we're learning right now is really how the virus has affected communities across the state, namely the Navajo Nation. Some of our tribal partners have been really devastated by this virus in a way that almost nobody else in Arizona has. Those are places that are still going to be at risk because of the healthcare system as well as health conditions. So even as we get closer getting past the hump of this outbreak, we're still going to have a lot of at-risk populations that we really need to focus on. What we're seeing with the metropolitan area, especially in the Phoenix area as well as in Tucson, that the rates for the population are actually fairly low. Certainly the disease is terrible, but overall the healthcare system's been able to handle it, and it's pretty well spread out throughout the metropolitan regions, so we don't really have hotspots. But as we move forward, we really need to focus on who's been affected by it, who has immunity, and we do that with serology tests, these antibody tests that people are talking about. TGen is absolutely bringing that on board because it's really important to know who was exposed, who is immune, until we get a vaccine in place. The virus test right now is that swab that they go really deep into the nose or in the back of the throat. That's looking for the live virus. When we do the serology test, we actually have to look in the blood for circulating antibody. Maybe more exciting, and one thing that we're focusing on is a much easier way to take that sample, just a finger pinprick, and we can collect that in very large numbers and look at larger populations very quickly. So instead of hundreds of patients, thousands or tens of thousands of patients on a regular basis to help understand who really can get back to work or who's still at risk for being exposed. Arizona will get back to normal, but it will be a new normal, there's no doubt. It will be everybody back to work, but we're also going to be making sure we're doing all those other things like the hand sanitizing, hand washing, all those things that we've always said are important. We really need to take that to heart.